Hello everyone, good morning. It's lovely to be with you again in Chieveley, if only virtually. And it's especially good to speak to you on this St. Luke's Day. We're going to share this update from Mahesa in the time of COVID-19. This is the first year for 20 years that Richard and I have been unable to visit Mahesa. The picture here of the Mothers Club was taken last year when we took a group of bereaved young people from St. Michael's Hospice, Herefordshire, to visit Mahesa. We showed the film of this to you all last year, and it's now on the internet for everyone to see. This is an update from the hospital and the hospice in the time of COVID-19. But before we move on to an update from the hospice and hospital, I want to talk to you about Dr. Sally Amos, because many of you will remember Sally. She worked for 10 years as a USPG missionary in Mahesa. Sadly, Sally died of breast cancer last Sunday. Over the past 2 years, she'd been working hard to raise funds through Medicines for Mahesa to build a mother's waiting home in the centre of Mahesa town. This is the foundations. The building is now almost finished. The home is for mothers who are waiting to go into labour but live too far from the hospital. A wonderful living memorial to Sally, honouring her work in Mahesa. So please pray for Ben, Zach, Piran and Max at this very sad time. We all know what is happening here in the UK, with figures published daily about COVID, but information from Tanzania has been very sparse indeed. There have been no official figures since April, and the official line currently is that there is no COVID in the country. They had a very short lockdown when schools were closed, but by the end of June, everything was open again. The President Magufuli, who is up for re-election this weekend, told everyone at the beginning in April to go to church and the mosque and pray and the problem would go away. But he said nothing about social distancing. We heard stories back in May and June about hospitals overflowing in Dar es Salaam and Zanzibar, about people dying in the streets and difficulty finding places in mortuaries. But this was certainly not the case in Mahesa or in the hospitals we're currently involved with in southeast Tanzania. They had a few cases, but it seemed to have been contained. The government had not provided any PPE, but the Hereford Link Society came to the rescue and sent £1,000 to Mahesa Hospital and the hospice. And the picture shows Tanzanian health workers in their PPE and a sanitizing station for hand washing. So where does the hospice fit in a COVID pandemic? It seems that people were not going to hospital with COVID symptoms, but were staying in the villages and dying there. This is where Mahesa Hospice Care became very important with their home visiting service. They had guidelines on end-of-life care, especially in COVID, and the use of PPE and morphine. Here in the UK, COVID has changed the guidelines on the use of morphine. It's now the drug of choice for breathlessness. And Mahesa is one of the few hospitals in Tanzania with access to morphine. The program we are running in southeast Tanzania is to educate palliative care teams and enable them to access morphine and use it safely. One Saturday evening in May, during lockdown, we had a message from a doctor in Ndanda, one of our new centres, asking for help. He had a patient with an oxygen saturation of 52%, this is really low, who was very distressed and struggling. He thought it was probably COVID and wanted to know how he could help him. The hospital has just gained its licence to dispense morphine, so we encouraged him to give a dose. The next day, we had a message saying the patient had responded well, become very quiet, able to breathe comfortably, and was able to talk to his wife before he died peacefully a few hours later. The patient had expressed his thanks to the doctor. The team in Ndanda, who I referred to in the last slide, is seen here beside the Maheza Hospice Care car, waiting to go on a village visit in April. Maheza Hospice Care is the centre of excellence where the teams from southeast Tanzania spend a week doing the clinical attachment and seeing palliative care in action. After doing their attachment, the Ndanda team sent a message to the next team from Sokoine Hospital, Lindi, saying, "You will not remain the same after that attachment." This is high praise for the team in Maheza led by Edgar. The other picture is the Sokoine team with Edgar in the middle. Many of you will remember Edgar, who came to speak here in Chivli in 2016. For the past 3 years, you have raised enough funding to pay for Edgar's salary each year. Thank you so much, and please keep up the good work. Another way M4M has helped the hospital in the past few months is with their electricity bills. Those of you with electrical savvy will be appalled at this picture. The hospital has 1 meter on a high tariff, so Medicines for Maheza have helped them to replace this with 3 new meters. Total cost of the replacement is £2,800. All of these are on a low tariff, and this should lead to an annual saving of about £3,000 a year. The current government is not enthusiastic about faith-based institutions or NGOs, and the government has built a new hospital, district hospital, about 2 miles away from Maheza, in Lusanga. This is a picture of the new hospital. It's currently only open for outpatients. Rather than seeing this as a threat to their existence, St. Augustine's, Maheza, have seen it as an opportunity to up their level of provision, and they are working on becoming a specialist centre for paediatrics, hoping to build a new paediatric ICU and a specialist centre for surgery with their new hernia service that they have set up, and of course, specialists for palliative care. So after this whistle-stop tour and update, sadly very second-hand due to our lack of personally visiting, what are our plans for the next year and beyond? Well, we do hope to visit towards the end of 2021, as long as there's a vaccine available. We were planning pre-COVID to hold a Maheza marathon, or possibly a half marathon or 10K, to raise funds for the hospice, rather in the same way as we took the young people out there last year. But this is now on hold. Anyone interested in doing this, do let me know, because hopefully it might take place in 2022. This year, more than ever, we need your help. Fundraising has been impossible, and it's supporters like you who are keeping us going. Just as important, we need and value your continued prayers. Anyone who missed seeing the 2 films that we produced about the work of the hospice and the Young People's Visit can find them now on the hospice website. So thank you all for listening and for all your support. We hope to be with you next year in person. And we hope that COVID will not hit Tanzania in anything like the same way as it has devastated this country. Please remember us in your prayers. Amen.